keep hearing mention of the words big data. So I want to find out what is big data, and more importantly, how it affects patients and their treatment. So come and join me as I talk with the various people concerned. So I guess the first question really is, what is big data?
So big data is big. It's huge, there's lots of it and it's detailed. But also we know that cancer is a disease of genes, and now we can map the cancer genes in great detail and at great depth for every single patient.
I assume that the idea here is the more you know about something and the more data you have on something, the more you can analyse it, the more you can find out the answers to the questions you really want.
Absolutely, but one of the challenges with these big data is often the knowledge is really deeply hidden. So we have to use really powerful computers to allow us to analyse it, to get those nuggets of knowledge out of it.
What patients really want to know is, what does it mean for them?
Cancer can develop resistance and it's changing, and we need to outsmart it and use this technology in order to keep adapting the treatment to beat it. We are curing over half our cancer patients, which is a really exciting thing to remember. I want to be able to tailor the treatment to each individual patient over time. So we follow the patient through their treatment and we change and adapt it in response to the changes that are happening in that individual patient.
Robin, you deal with sarcomas, which they're cancers of the soft tissue and bone.
Correct. They're very rare cancers, accounting for about 1% of adult cancers and about 15% of childhood tumours.
Right, so how's big data going to help you in that respect?
At the Royal Marsden, the Sarcoma unit has a clinical information database that's been in existence since 1990. So that can provide us a whole load of information regarding the benefit of certain treatments in specific types of sarcoma. We're clearly moving away from this one-size-fits-all approach. So big data can be very, very useful.
So, what have we learned today? Well, we learned that big data is not only about collecting high volumes of data, it's about collecting data from a wide variety of sources. So that's the patient data, the type of their cancer, and we learned that cancer evolves, so there's very many different types, the treatment that they receive, the effect that that treatment has on them, as well as information from the scans. And why is that important? Well, it's important because collecting that big data and then analysing it provides a much wider and deeper understanding of the patient and their cancer.